time we'll get it together. We have it together. And I'm Dr. Dietrich. We're going to reintroduce ourselves so we can start off fresh, okay? So we'll start off with Dr. Khadijah. And tell us a little bit about yourself, Dr. Khadijah.
So, hi there, I'm Dr. Kadisha. I'm your board certified emergency medicine physician, sports medicine fellow, and entertainment industry mobile MD, as well as author of the best selling book, Help Us Help You in the Emergency Room. My ER care and advice helps people feel better, be safer, and better prepared for emergency medical situations. And you can find me at DRKADISHAMD on Instagram, Twitter, and on my Facebook page. Brett,
Ooh,
glad
excellent. Excellent.
All right, and hello. I'm so glad to be on with my colleagues. I am Dr. Carol Penn, doubly board certified in family medicine and obesity medicine, and your master movement meditation and mindset coach. Also, the author of the best-selling book, Meditation in a Time of Madness. I come to you with my podcast, my blogs, my speaking engagements, and my online courses for self-improvement and development. So happy to be of service and to share the information that we're about to share today.
Excellent. And I am yours truly, Dr. Dietrich Gorman. I am your board certified family practice physician, and I'm also known as America's Relaxation Doctor. I'm a best-selling author, speaker, an entrepreneur, and I help individuals who are stressed at work learn to relax and refocus in order to have a more healthy, productive, and fulfilled life. And I'd like to welcome y'all once again to our perspectives in primary medicine. And we're going to be talking today about corona, okay, the coronavirus. And I know you turn on the TV, you turn on the radio, you're on social media, and you can't log on anywhere without seeing something about the coronavirus or hearing people say something about it. Everybody has something to say about it. Well, we need to, okay? And just to let you know, the information shared to you this afternoon is actually taken from the CDC or other trusted resources that we feel that are trusted. Okay, and understand that even though we are board certified family medicine or emergency medicine doctors, we're not your doctors. Okay, so we're providing you here with information, good information, but it's always good to discuss things with your own personal doctor. Okay. And this information that we're going to be providing to you is definitely not to instoke fear and anxiety out there for y'all, but just to educate y'all. We're here to stress the importance that we need to work together. We need to educate each other. We don't need to play into extra fear, but we want to make sure that y'all understand that this is serious, and we implore you to follow the recommendations and guidelines so we can help decrease the spread of this virus. Okay. So I think that's a good introduction right now. Um, I'm going to go ahead and get started on things. I see a couple of people have tuned in. I see Rosie, thank you so much, and I see Kasali, thank you so much for tuning in. We're going to keep going, okay?
Right.
So we'll be talking today about actually what is a virus versus what is a bacteria. Some of you may need a little bit more clarification. Actually, what the coronavirus is, as well as the most current statistics. Then we'll talk about symptoms, treatment, prevention. Okay, so please, if you feel that there's anyone out there who can benefit from this information, or if you're coming in late, that's fine too, but try and share this live stream with others. If you're going to be watching this on the replay, just kindly put hashtag replay in the comments so that we can see that y'all are there, okay? All right.
I'm
So
going to be
this
taking notes too.
yeah. Huh?
I'm going to be taking some notes
Oh,
too.
good, good. Yeah, you can definitely take notes here. I see Yvonne has tuned in as well. Thank you very much, Yvonne, for tuning in on this Saturday. I know a lot of people may be out and about, but we're very grateful that you've taken the time to listen to us today, okay? So, okay, I'll get started. I am Dr. Dietrich Gorman again, and I'm going to be talking about the basics. I'm going to start from the kind of the beginning. So you're hearing that the coronavirus is a virus. Yes, it's a virus. But what does that mean? Okay. Maybe most of you have heard of bacteria, the word bacteria, and you're kind of not sure, what the difference is. Well, I actually want to break things down and actually explain to you what the difference is between a bacteria and a virus, and then I'll move a little bit forward, okay? So, viruses and bacteria, they both have similarities in how they manifest themselves in our body, but they're actually quite different, okay? So, what are some of the similarities? They both cannot be seen by the human eye, meaning they're microscopic. You actually need to get a microscope to look at them. And isn't this something else that something you can't even see can cause so much problems, destruction, death, illness, headaches, you name it. Something you can't even see can really mess with your overall health. Another similarity, though, is when you're infected by either a virus or bacteria, you can actually have similar presenting symptoms, such as like a fever, headache, nausea, cough, earache, sore throat, runny nose. There's similar presenting symptoms if you have been infected by a virus or bacteria. Does any of these sound familiar to y'all? Lots of people run around with, runny noses and cough. Okay. Also, another similarity is that they both come in different sizes. Okay, they're not just one type of looking bacteria, one type of looking a virus. They're both different. Okay, now bacteria. Get into the differences. Bacteria are actually single-celled organisms. They can actually divide on their own. They can live on their own. They're actually found everywhere. They're found in our body. They're found on our body. They're found in the food, the atmosphere, the dirt, just kind of everywhere, okay? And in healthy people whose immune systems are intact, many bacteria don't actually harm us, but some do, okay? And you can actually treat bacteria with antibiotics, okay? Now, on the other hand, you have viruses. Viruses are actually quite smaller than bacteria microscopically. We can't tell the difference either way, but if you're looking in the microscope, they're typically smaller than bacteria. They actually need a host to replicate, okay? Viruses actually contain genetic information in the form of DNA or RNA. And because viruses invade a living host cell to reproduce, their lifespans outside are generally shorter than bacteria that can exist outside of the body. Okay. And which, like I said, they can't reproduce on their own. And although viruses can actually survive outside a host on like household surfaces, their ability to actually duplicate is compromised, which shortens their lifespan when they're outside. Okay. And so, like I said, viruses need a host cell to replicate. And this means actually that the virus actually needs to find a way to invade the cell, which is a host, and it does, inject its RNA or DNA into that host cell. Then that receiving cell incorporates that virus and that virus just takes over that cell, okay? It keeps replicating and replicating so many copies of itself, then that cell busts open with all these viruses and it goes out and infects the other neighboring cells. So that's how viruses get around. And the thing is that you actually cannot, and I repeat, cannot treat a virus with an antibiotic. Antibiotics are for bacteria. And so that's like the big difference between those, okay? And you may, if it's effective, may be able to have an antiviral drug, but it only helps lessen the symptoms. And what they do is hopefully help decrease the ability for the virus to reproduce, hopefully, okay? While your immune system is kicking in to fight it. So you've heard, a virus, your body has to run its course. You've heard of that term before. Now, to the coronavirus, okay? The coronavirus is named for its appearance. It's like a crown. It looks kind of like a crown under the microscope. That's what the experts are telling us. And it has like spikes on its surface. And there's actually many types of coronaviruses. Some affect humans and cause symptoms like the common cold, and some may infect only animals. But I believe there's only like 7 coronaviruses that can actually infect people right now. So, but what are we talking about today? This novel coronavirus, or the COVID-19, COVID-19. So a novel coronavirus is actually a new coronavirus that has been discovered that's not been previously identified in humans. And this coronavirus is not the same as a coronavirus that causes a common cold, which is milder. And a possible theory that's out there is that maybe an animal corona has jumped into the human species and somehow it started spreading, but this is just a theory, okay? Um, any questions? Okay, no.
Well, I actually have a question.
Mhm.
So, Dr. Dietrich, how long can a virus live on your cell phone or on a computer screen?
Okay, well, in my reading, it's kind of funny because I'm looking at different resources, and it's kind of a little bit different. Okay, so they're quoting anywhere from a few hours up until 9 days. I'm like, wow, that's a really big difference. You know what I mean? So I mean, there was multiple, places I looked at that didn't really give a one stop shot that this is the last a couple hours. It's anywhere from a few hours to up to 9 days. And so I'm sure we'll be getting more information as more research and stuff is being done, to see exactly, what are the precipitating factors if it's living longer on this one particular surface versus another particular surface. So great question. Okay. And so I'm coming towards the end of my talk, but just to share a couple of statistics from the World Health Organization. Right now, there's 142,538 confirmed cases. This is in the world, and resulting in 5,300 deaths. Okay. I do want to keep things in the perspective for y'all too, just to understand in the world right now, we have over 7 billion people. That's a lot of people. Okay. In the United States, we have about 1,600 cases and about 41 deaths. Okay. They're all in, I just read earlier today, I think it's all in the 49 states now. Okay. One case or another. But to keep things in perspective as well, in the United States, we have about 320 million people. Okay. So that's just, good information to kind of keep things in perspective and not necessarily panic or not panic, but just to be educated and informed to see where we are right now with this virus. Okay. So I guess thank y'all for listening. For me, Dr. Dietrich, I want to turn the mic over to Dr. Khadijah. She's going to be talking about transmission, the clinical presentation, testing, treatment. I mean, she's an ER doctor, so she's going to be getting a lot of these people coming in, at the wee hours, wondering what's going on. Do I have the corona? Help me. I need help. So she's going to give us her perspective. Go ahead, Dr. Khadijah.
Well, thanks, Dr. Khadijah.
Certainly.
Hi there. So again, Dr. Khadijah here, and I want to just off, and I appreciate you putting that in perspective too about the actual world population versus the number of cases and fatalities. That definitely helps keep things in perspective and should help keep us from panicking. Now, because we've made it through multiple, pandemics and epidemics before, and it's funny that the virus that causes COVID-19 is actually called the severe acute respiratory syndrome coronavirus 2, because way back when, in the early 2000s, we did have another SARS infection that had started in China, and we made it through that. So as far as the clinical presentation for this, so if initially COVID-19 against a novel virus was discovered in 2019. It initially presented as a cluster of pneumonia cases in the Wuhan city of Hubei, which is a province in China.
Mm-hmm.
And it said that initially this was a virus amongst animals, but then it mutated and crossed over into the human population. So from animal to human transmission. And they think it occurred through association with a seafood market that sold live animals. And then as the outbreak progressed, transmission continued on person to person and mainly via respiratory droplets. Similar to the flu, but there is a difference. They're considering the possibility that COVID-19 might be airborne as well, meaning that it lingers in the air, and so a person can be exposed to it long after the other person who secreted that is gone. So, but mainly it's respiratory droplets, and this means that the virus is released in the respiratory secretions that we release when we cough, sneeze, or talk. And have you ever had that sensation when you're talking to someone and that little piece of saliva lands on your lip? I think Ellen DeGeneres does a whole routine about that, and you're trying to smile and listen, and but you're thinking about that.
Yes.
There. And unfortunately, that is one way that we can get it. So it's those small droplets of saliva or mucus that can infect us when the virus lands on our mucous membranes, that's the moist membranes of the eyes, the nose, or the mouth. Luckily, the droplets don't travel more than 6 feet, or if you're on the metric system, 2 meters. And they don't, well, it's still, the jury's still out about whether or not it lingers in the air. But in certain situations, especially in the hospitals, where there are situations where aerosols can be released, such as during CPR or during intubation, which is when docs like me have to put a breathing tube into someone's mouth. We are very close to that person's mouth. And that's the only time right now where we're considering airborne precautions. So again, back to the presentation though. So typically, more typically, it's not going to present as a severe case of pneumonia. Typically, it presents with fever, cough, and shortness of breath. But the concern is pneumonia. According to UpToDate, which is a common reference that physicians use, there was a study of 138 patients from Wuhan, and it revealed the most common features of COVID-19. That being 99% of those patients had fever. Fatigue presented in 70% of them. There was dry cough in about 59%. Loss of appetite or anorexia was 40%. Myalgias in 35%. Shortness of breath in 31%. And sputum or phlegm production was 27%. And of those folks, about 12.3% of these people ended up needing help breathing via a ventilator after, again, placement of an endotracheal tube or a breathing tube, as it's generally called. So less common symptoms were headache, sore throat, runny nose. Even less common was nausea, vomiting, and diarrhea. So generally, there are no specific symptoms that reliably distinguish COVID-19 from other viral illnesses. And I know that's the scary part, but there is some comfort from that because most of us recover from it. So while the coronavirus and the flu both cause fever, cause coughs, body aches, fatigue, and sometimes vomiting and diarrhea, while there are similarities, there are some differences. Now, I don't want people to sleep on the flu, and I just have to say this. Everybody's clamoring for the coronavirus vaccine. Where's the vaccine? Where's the vaccine? Where's the vaccine? There's a vaccine you can take right now to help prevent you from getting a virus that kills thousands of people every year. And that's the flu vaccine. Is right down the street. And you might be able to get it for free based on your insurance coverage. So if you're considering or, worrying about getting the corona vaccine and when it's going to be ready, because it's not going to be ready for about a year, go out and get the flu vaccine. So the coronavirus and the flu, they can both be severe, even fatal. They both can cause pneumonia. They both spread person to person, primarily through respiratory droplets from sneezing, coughing, and talking. But because COVID-19 is a novel virus, and novel being that we've not seen it before, that is what causes the main concerns. We've not seen it before. We don't have the tools for it. We don't have a vaccine. We don't have medication, and we don't have natural immunity to it. The flu throughout history has killed, millions of people, but there was also a pattern seen in that certain populations of people survived the flu because they had immunity to last year's predominant strain. And, in one pandemic, the elderly were less affected. In another pandemic, folks 30 to 60 were less affected. But with COVID-19, no one has any immunity to it because it's new to all of us. So CNN put out an article saying that, yes, more is known about the flu than COVID-19. Another thing with the flu versus COVID-19 is that headaches and chills are less common. So you may have headaches and chills more frequently with the flu or another kind of virus, maybe even another strain of the coronavirus, which is common enough also. Flu symptoms tend to come on more rapidly, while symptom onset with COVID-19 is more gradual and can take more time to worsen. It also appears that COVID-19 spreads farther and faster than the flu. So, and then we have this, novel property to it, meaning nobody really has immunity to it. As far as the fatality, flu becomes fatal typically due to a secondary bacterial pneumonia, and unfortunately heart attacks brought on due to decreased resistance from the flu. COVID-19 typically kills by acute respiratory distress syndrome, in which lung tissue that is already damaged takes on fluid. And unlike pneumonia, for which we have antibiotics, and like Dr. Dietrich said, we have antiviral medication, there's no treatment for what we call ARDS, acute respiratory distress syndrome. And that's why they call it SARS, because it's an acute respiratory syndrome. But just the good news though, most people who get the flu or who get COVID-19 have mild to moderate symptoms, if any symptoms at all. 80 to 90% of us will get over this. There's a mortality rate and I know the folks who are healthy, the worried well, you're wondering, well, what's my mortality? Couldn't I still die if I don't have the underlying conditions of hypertension, diabetes, cancer, things like that? There is a mortality rate, but it's small. It's 0.9% for folks with no underlying medical conditions. As far as people with underlying medical conditions, the mortality rate has been about 10.5% for people with cardiovascular disease, 7% for folks with diabetes, and 6% for folks with chronic respiratory disease, hypertension, and cancer, respectively. Now, from reports gathered so far, what about the children? Children tend to have milder symptoms, and they might have fever, cough, congestion, and runny nose. But just know that even though this is a pandemic, more people will not be infected than will be infected. More people will not be infected than will be infected. And so this leads to testing. And I've seen the articles from CNN talking about people across the country saying, well, I'm sick. Why can't I get tested for the coronavirus? And our leaders are saying we're gonna get tests and they're gonna be available for folks. I even heard talk about drive-through testing for coronavirus. It's impractical to expect to get tested just because you want to get tested. And the way that they figure out who is most appropriate for testing is certain criteria. So, because I just came off a 24-hour shift, and so we had to learn this stuff. So there's certain categories. So there are the people who have fever or signs of lower respiratory illness, like cough or shortness of breath. And then in addition to that, their epidemiologic risk is a person, including healthcare workers like us, who've had close contact with a laboratory confirmed COVID-19 patient within 14 days of symptom onset. Those folks meet criteria for testing. Another one category is fever and signs of lower respiratory illness, be it cough or shortness of breath, not needing hospitalization. A lot of folks are going to be discharged home with COVID-19 to self-quarantine for about 2 weeks. One of my supervisors just got back from Italy, and she's got to stay in the house for 2 weeks. So you have those characteristics, and then you have a history of travel from affected geographic areas within 14 days of symptom onset, or you are an individual with risk factors that put you at risk of poor outcomes. So, like I was saying before, the hypertension, diabetes, cancer, and all that, but there are some people who might be transplant patients who are chronically on steroids and other immunosuppressants. So those folks get tested. And then finally, there are the folks who have fever and the coughing or shortness of breath who need hospitalization. So of course, they would need testing, even if they have no source of exposure, they get tested. So so while testing kits are limited, we have to go by these criteria. I know folks out in front of the microphones are talking about how everybody should be tested, but I don't think that that's really practical, and because it is limited, we have to go by these criteria. So do understand that, we're not trying to turn you away because we don't think what you have is real or anything like that. It's really because we have limited tests, and there are people who really, really, really meet the criteria. So what if you do show up positive for COVID-19? Unfortunately, like we were saying before, there's no treatment. There's no treatment for COVID-19. There's treatment for the flu, and even that is not really treatment. It lessens the severity and decreases the duration of symptoms. And then it has its own side effects that are sometimes similar to the viral illness itself. There is a company called Gilead. It's an American pharmaceutical company that is working with people in China, and it's working to develop a medication called remdesivir. And I think they're about to start clinical trials. Other than that, there's about 9 or 10 other companies that are working on vaccines, and they're at different stages of development, be it from preclinical to clinical trials. But, while that's hopeful, they are letting us know there's no, don't expect much until next year. So what can we do? All we can do is focus on prevention, right, Dr. Carol?
That's exactly right. That's exactly right. We need to focus on prevention. So I just want to bring us home with some good news. I know everybody's shoulders have crept up here like this, and you're feeling nervous and stressful. And many people are feeling this stress from this. I ran a few errands, and being out there, I touched base with my banker, who was expressing her concerns. I've touched base with, friends and family. So as my state, New Jersey, is shutting down bit by bit, and they're getting ready to close all the schools in New Jersey. And the idea behind all of this is to prevent a massive spread. And as you heard from Dr. Dietrich and Dr. Khadijah, how this contagion is spread. So let me tap into the positive.
Right.
I'm going to talk about what we can do to reduce our stress levels, and how I hope to have enough time to go over 5 things that actually are evidence-based and proven to boost our immunity, because our best defense, hands down, evidence-based, is a strong immune system.
Absolutely.
So if you have a strong immune system, you're less likely to catch whatever is out there, including the new novel virus of COVID-19. So let's go with some of the importance of managing and reducing our stress. So stress, many studies have shown, and you mind if this is so important, I wrote some notes, so I just wanted to make sure I covered my points. Many studies have shown that high levels of stress decrease immunity and indeed make us more vulnerable to viruses, including, in at least one study, a variant of the coronavirus. People need to use the meditative techniques that they've learned, and this will help bring the mind and the body into balance and enhance immune function. So if you've been thinking about studying some meditation or learning meditation, now would be the time to do that. And since you can't go out shopping into that big event and there's no March Madness, you now have some time. So this is the time to do it.
Yeah.
So entering the state of relaxed moment-to-moment awareness that meditation brings will also help you see the threat realistically for what it is, not what you imagine or fear it to be. And that is very important in reducing your stress. Everybody take a deep breath. Beautiful. Don't you feel better already?
I
Let
do.
your shoulders just fall down. Number 2, exercise. Physical exercise definitely enhances immunity, evidence-based, as well as decreases our level of stress. Do it on the regular. Studies have shown that as little as 20 or 30 minutes a day can make a real difference. I personally feel much better when I'm stretching, doing yoga or qigong, and getting in some mindful or purposeful movements for 1 hour each day. Now, do I do it all in a row? No, but when I go to the store, I park on the far side of the parking lot so then I can walk across the parking lot and get those steps in. So that's what I mean by being mindful or intentional. You can work it right into your day. You don't need a gym membership or fancy clothes to get that purposeful movement in. But better yet, if you could add some things in like the yoga or the qigong or some aerobic exercise to reduce your stress and boost your immune system. And better yet, it's free, right? So far, this is no out-of-pocket expense. These are something that you could do now that we're all going to have more time with your close circle of family and friends. 3, nutrition and food. When we're stressed out, our GI tract is as much under siege as our brain. Food and supplements can play a major role in brain healing, immune enhancement, and stress reduction. You want to remember that. I wrote about that in my book, Meditation in a Time of Madness, the importance of nutrition and food and high quality, nutritious food that really, really helps us boost our immune system functioning. Number 4, you want to use techniques that mobilize your imagination and intuition. So this maybe gets into a little bit more of a learning curve, but there are some really excellent apps out there online, again, that are downloadable and free that are available. There's one called Calm. This is not a particular endorsement, but it's something that is available as a resource that can take you through a guided imagery to help you relax. They have a whole bedtime section
Yeah.
that's purposeful for adults. And we're upon World International Sleep Day, and sleep
Oh,
and rest is also critically important to boosting your immune system. If you're not getting the amount of sleep that your body needs, you are actively weakening your immune system. And 5, this is my last evidence-based tip for today: reach out to other people. Interesting studies have been done by Sheldon Cohen and his colleagues at Carnegie Mellon, showing how important other people are in enhancing our immunity and resistance to infection by viruses and the illnesses they cause. One study indicated that 32% of the stress reducing effect of social support was due to hugging. And right now, we are not supposed to be hugging. We are elbow bumping. So we gonna elbow bump, and we gonna virtual high five. But this is also where we can put a great use of the technology, right? Where we could go on Zoom, where we can go on these platforms and we can see the smile of people that we feel connected to. And we could use the technology in the most supportive of ways, for the ways that it can enhance and help us get through a difficult situation and a stressful and anxiety producing situation. I hope this has been useful to you.
that's very, very useful. And, you know, one of the things I heard from you too is about like when we're under stress and whatnot, we tend to go for things that are comforting but not necessarily healthy. And so it's really important to give our bodies something to work with to boost our immune system. So
Yes.
don't go for the poor foods. Go for the good foods, even and make comfort in that because you know it's going to benefit you in the long term. It's going to build you up so that you can fight
Yes.
all these diseases and infection. So I appreciate that.
Yes.
And
Yes.
Dr. Khadijah, I hope she can come back soon. I'm not sure what happened, but she gave us some great
Technology.
information. Oh my goodness. And so I just wanted to chime in right quick. There's a couple of people who came in. I wanted to thank you once again for sharing your Saturday with us. Katrina, Marlene, Jera, thank you so much. I see Marlene asked the question, what about pneumonia vaccine for seniors? Yes, it's very important to have your pneumonia vaccine if you're a senior. There's a vaccination schedule for adults. Please see your doctor to see when and where you should get this vaccine. There's certain age cutoffs to get these things done, but it's very important and very beneficial. Prevention is key. Prevention is key, and that's what
Yes.
vaccines are there for. So thank you for asking that question, Marlene, okay? I wanted to see if there's any other questions before we kind of wind it down. And hopefully Dr. Khadijah can join us back. But like I said, she gave us some great, valuable information.
Yes.
And I can't wait for us to do another Perspectives in Primary Care. We'll come back with another topic and we'll just give y'all some information and some enlightenment, and it helps us as well. Okay.
Dr. Dietrich, how can people reach out to you?
So thank you very much for asking. You can definitely reach me on my website at drdietrichg.com. That's DRDEITRICKG.com. I'm on actually all social media. That's including Facebook and Instagram and Twitter, LinkedIn, YouTube. I actually have a podcast now called A Calm Mind is a Receptive Mind. And you can kind of just see me everywhere. Okay. When I'm doing my speaking at events, I'll be live broadcasting there as well, so you can just see what I'm talking about. And what about you, Dr. Carol? How can they get a hold of you?
Well, people can reach me on my website, www.drcarolpenn.com. That's DRCAROLPENN.com. I have a scheduler on my website. If you want to schedule a 15-20 minute chat with me, I welcome that and would be delighted to speak to anyone. And you can reach me likewise across all social media at Dr. Carol Penn.
Thank you so much. I did see someone chime in with a question, which is an excellent question. How about washing hands? No
Oh,
pun intended,
yes.
but hands down, that's very, very important. Like one of the most important things you can do. Thank you for asking that question, Kasali. Washing your hands, warm soapy water. Don't just go and then, you have a nice lather in there, rinse your hands off very well, and then pat it dry. There's also hand sanitizer that's out there. I know there's this big mad rush for people going to get hand sanitizer. So I don't know how much available that is, but a bar soap is great too.
Yes, a bar soap actually that gets the virus off of
Oh,
your
I
skin
prefer bar soap
completely.
better. Yes.
So you want to, and you want to wash, if you sing the alphabet or you sing happy birthday, that's about as long as you need to be
Yes.
rinsing. So I'm telling people, when you get into the habit, when you walk in the door, wash your hands. When you get ready to leave out the door, wash your hands. So every time you come and go, that will increase the hand washing frequency alone. If you just say, I'm coming to my house, I need to wash my hands. I'm
Yeah.
leaving my house, I need to wash my hands. All right.
Right. Thank you for that question. That was great. Okay. So I think, okay, one second. Let's have Dr. Kadisha just
There she
take us out of
is.
here.
I had to come
Okay.
back with my smartphone. Okay.
Well, welcome back. We were just, someone asked a great question about hand washing, and so we just talked a little bit about that. But we're definitely ready to wrap us up. If you want to give us any parting words, and we can tune in for next time.
Okay, so most people, if you have an intact immune system, you have like an 80% chance of getting through this. If you even get infected, you have an 80 chance of getting through this with mild to moderate symptoms. Don't go out and buy all the eggs and everything. People are just emptying the grocery stores. Don't panic so much. Wash your hands. Stay at least 6 feet away from people. Use hand sanitizer when soap and water isn't available. Cover your sneezes and coughs. And if you need anything, I'm here for you in the ER.
Okay, well, thank y'all very much for joining us. I'm Dr. Dietrich with Dr. Carol Penn and Dr. Khadijah Rapp. We'll see y'all next time on Perspectives in Primary Care. See ya. Bye.
Bye.